pi. So the rate limiting step in the synthesis of cholesterol will be your HMG CoA reductase enzyme. So which is the drug among this which will going to inhibit the HMG CoA reductase activity? So again a direct question, that is your statins. Statins are the one which is going to inhibit the HMG CoA reductase inhibitors. Thereby it increases the LDL receptor expression on the liver, and this in turn will going to increase the LDL uptake into the liver so that it can synthesize the bile acids and the steroidal hormones. Thereby it will decrease the LDL levels. So statins will going to decrease the LDL levels. So next, moving on to the sixth MCQ, that is a lipid lowering drug that significantly reduces lipoprotein A. Again a direct question, that is nicotinic acid is the one which will going to decrease the lipoprotein A, as well as it will going to decrease the fibrinogen. So this is the statin, and these two belongs to the fibrates. They basically act by activating the paroxysmal proliferator activated receptor alpha and stimulate the lipoprotein lipase. So these are longer acting drugs because of their prodrug, and please remember that there is an increased risk of myopathy if you are combining this fenofibrate as well as gemfibrozil with the statins. Exception is bezafibrate, whereas all other fibrate will going to cause the increased risk of myopathy if it is administered along with the statins. So let us understand one more concept here. So which has got the maximum capacity to reduce the LDL levels, which will reduce the triglyceride levels, which will going to increase the HDL levels. So to increase the HDL levels, you have got niacin, and to decrease the triglyceride, you have got wonderful fibrates, and to decrease the LDL levels, we have a powerful statin. This you should keep in mind. So next, coming to the which of the following drug has got maximum oral bioavailability. So here among this, the maximum oral bioavailability is seen with, please remember, that is the fluvastatin has got the maximum oral bioavailability. Next, coming to the eighth question, that is most potent statin is. So which is the most potent statin here? So two concepts you should remember. So which is the most potent one, and which is the longer acting, or which has got longer T-half? So the most potent being P for P. So answer is pitavastatin. So which statin has got longer T-half? That is your rosuvastatin. So again, very very important. So potent is pitavastatin, longer T-half is rosuvastatin. So here the answer will be your pitavastatin. So which of the following statin has got longest half-life? So the longest half-life is seen with the rosuvastatin. So next, moving on to the 10th question, that is which of the following drug is best for reducing proteinuria in case of diabetic individuals? So among the diabetic individuals or with normotensive individuals, so AC inhibitors is the drug which will going to reduce the proteinuria. So in case of normotensive and diabetic individuals, it will going to decrease the protein excretion. That means it decreases the albumin excretion, thereby it prevents the progression of kidney damage. So by using which among this option is a AC inhibitor? So this is the beta blocker, so this is the thiazide group of drugs, and this is the centrally acting and antihypertensive drug. So it is the perindopril. So pril is the common feature of the AC inhibitors. So here the right answer will be your perindopril. Next, moving on to the 11th MCQ, that is the cough and angioedema in a patient receiving AC inhibitor is due to. So please remember the cough, that is dry cough, and the angioedema. It is mainly, both of them are mainly due to the increase in the bradykinin levels. Since it inhibits the AC inhibitor inhibits the AC enzyme. This AC enzyme is required for breakdown of bradykinin. So you are inhibiting it here. So what happens to the bradykinin levels? Bradykinin levels will go up, and this is responsible for cough and angioedema. Is that clear? Fine. We'll move on to the next question, that is a 12th question. A sudden withdrawal of which of the following drugs could result in serious adverse cardiovascular changes in a patient who is taking a drug over a long time? So usually the withdrawal symptoms are seen with the, if you check for the option, you will come to know it's not seen with phenylephrine or enalapril or fluoxetine. You can see not that much serious. So it will be seen with the clonidine alpha 2, which is a central antihypertensive drug, which mainly blocks the central alpha 2 receptor, presynaptic receptors. So is that clear? So in case of withdrawal or clonidine, you can give phentolamine as an antidote. To overcome the withdrawal symptoms of the clonidine. So next we have a drug of choice for hypertension in case of eclampsia. So the books will say that in case of hypertension, so the drug of choice will be your, what will be the drug of choice? It is your thiazides. So what happens in case of emergency? Emergency there it is calcium channel blockers, but JNC criteria says that nitroprusside. In case of gestational hypertension during pregnancy, the latest book will say it is the labetalol, and the JNC criteria says that it is your methyl dopa. And hypertensive emergencies during pregnancy, again labetalol is the answer, and the JNC criteria says that JNC criteria says that it is your hydralazine. One second. It is your hydralazine. So recent thing says that in case of the gestational hypertension as well as hypertensive emergencies during pregnancy, the drug of choice will be your labetalol. Is that clear? So the drug of choice for hypertension in case of eclampsia will be your labetalol. So moving on to the 14th MCQ, that is, which of the following is the first line drug for acute congestive heart failure? Again a direct answer. So it is your loop diuretics. So among this, which is a loop diuretics, that is your loop diuretics. So example, if they have given, you could have chosen furosemide. Is that clear? Okay. Next, moving on to the which of the following drugs diuretics causes hypercalcemia and can be used in recurrent renal calcium stones. So please remember, whenever you give a loop diuretics, so one thing you should remember, loop loses calcium through the urine. So what happens to the concentration in the body? There will be hypocalcemia. If you are giving a thiazide group of drugs, so what will happen to the calcium? So there will be retention of the calcium. Calcium is retained. So what happens to the blood levels here with respect to thiazides? So there will be increase in the calcium levels. So here it is matching. So hypercalcemia. Since there is no increased amount of calcium excretion, so there won't be any renal stones. You can prevent the recurrent renal calcium stones. So here the drug is the thiazide group. Here chlorothiazide is the thiazide group of drugs. So spironolactone is a potassium sparing diuretics and mannitol is a osmotic diuretics. Furosemide is a loop diuretics. Is that clear? Okay. In case of cirrhotic ascites, which drug is preferred? So please remember, in case of cirrhotic ascites, you're going to choose the spironolactone as a drug of choice. In case of edema due to CHF, the answer will be your furosemide. Again, if the edema is due to the renal disease or the nephrotic syndrome, the answer will be your furosemide. If it is a cerebral edema, the answer will be your mannitol. And if it is a cirrhosis, the answer will be your spironolactone. So is that clear? Spironolactone. So these things you need to remember. So CHF, it is furosemide. Renal or the nephrotic syndrome, the drug of choice will be your furosemide. And cerebral edema, it is your mannitol. And cirrhosis, your spironolactone. And one more condition is the pulmonary edema. In case of pulmonary edema, so again the drug of choice will be your furosemide. So the drug can be used in producing alkalization of the urine is. So again the direct question. So astazolamide is used for urinary alkalization. Why you need to do alkalization? To remove some of the drugs. Like alkalization is done for weak, basic or acidic. So you need to choose the opposite medium. For the weak acidic, it is not the weak base, please remember. So it is the weak acidic drugs you need to alkalize. So that what will happen when you alkalize the urine? So what will happen is there will be more of ionized forms, so which are water soluble, so that it can be easily excreted. So that's why astazolamide is used for alkalization of the urine. So mainly used for removing the poisons. So if there is a weak acidic drug poison, you can go for alkalization of the urine using the astazolamide. So coming to the 18th question, that is, a patient on cisplatin therapy, which of the following diuretics would be preferred? So as we discussed, to produce the rapid action, to remove the toxic metabolite after the cisplatin therapy, so the diuretic which is preferred will be your mannitol. So mannitol will be the drug of choice. So where it is contraindicated, mannitol. So please remember, mannitol will be contraindicated in case of the cerebral hemorrhages. In case of, apart from cerebral hemorrhages, if you have got any acute renal failure, you will be avoiding the use of mannitol. Cerebral hemorrhage, acute renal failure. Is that clear? But it can be used in case of cerebral edema. So if the edema is also associated with hemorrhage, it is contraindicated. So here the appropriate or the preferred drug will be your mannitol. So next, coming to the 19th question, that is, acetazolamide can be used in all except. So you can remember the mnemonic, the game for acetazolamide use. They are used in case of glaucoma. They are used for alkalization of urine, to alkalize urine, for mountain sickness, acute mountain sickness, and in case of epilepsy, that is the catamenial epilepsy. So you can use it here. What happens if you use it in case of the cirrhosis? So already cirrhosis, there will be buildup of ammonia levels, and if you give a acetazolamide, as you know, it alkalizes the urine. So what will happen to the ammonia levels? So the ammonia will become unionized, more of unionized forms in alkaline medium. So both are alkaline in nature, both have got basic pH, so they become unionized, means they are lipid soluble. So this can easily cross the blood-brain barrier, and it will going to cause hepatic encephalopathy. So that's why acetazolamide is not indicated here. Next, which of the following diuretics is contraindicated in presence of cardiac failure? So please remember, you can use spironolactone, you can use furosemide, you can use hydrochlorothiazide, but not the mannitol. Mannitol is contraindicated because of their rapid brisk action. Next, moving on to the thiazide, 21st MCQ. So thiazide can cause, again, a direct answer, you should remember, it causes metabolic alkalosis. Next, moving on to the 22nd MCQ, that is, all of the following adverse effects can be caused by loop diuretics. So as we discussed, it can cause hyperglycemia, it can cause hypomagnesemia, and also it can lead to hyperuricemia, but not the hypercalcemia. So usually loop loses the calcium. So what happens to the concentration in the body? There will be hypocalcemia, but not the hypercalcemia. So this is the answer here for exception. So next, 23rd question, that is, high ceiling diuretics are useful in the treatment of all the following except. So the furosemide can be used in case of generalized edema, in cerebral edema as well, in case of acute pulmonary edema as well, but not in case of pulmonary hypertension. So in case of pulmonary hypertension, you can go with the busentan, which is an endothelin receptor antagonist, and you have some prostacyclin analogs as well. So high ceiling diuretics is not used in pulmonary hypertension. So diuretics that can be used in renal failure. So please remember, the diuretic which can be used in renal failure will be your furosemide. So in case of edema due to any nephrotic syndrome or any renal dysfunction, so diuretics preferred will be your furosemide. Is that clear? Okay, fine. So what are the drugs which are causing the gynecomastia? So please, one has to remember the causes of gynecomastia. So this can be remembered in the form of mnemonic, that is DISCO. So D stands for digitalis. I stands for INH. S stands for spironolactone, and C stands for cimetidine, and O stands for estrogen. So here the gynecomastia is caused by, you ruled out the spironolactone. Next, coming to the 26th MCQ, that is true regarding conivaptan. So conivaptan is a non-selective which will act on V1A as well as V2, and this is mainly used in case of treatment of CHF. Through which route? Through IV route. So we have V1 selective and V2 selective also. So V1 we have relcovaptan, and V2 we have a lixivaptan and mozavaptan. So these are given through oral route. So conivaptan is not given through oral route. It is not a V2 selective action, it is a combined action of V1A as well as V2, and they are used in the treatment of CHF mainly. So the right answer will be here, it is a vasopressin antagonist. Next, we have a drug of choice for neurogenic diabetes insipidus. So what will be the drug of choice here? So please remember, in case of diabetes insipidus, if it is a neurogenic, or it is also called as central diabetes insipidus, then you have got the nephrogenic diabetes insipidus, and you have got the lithium induced diabetes insipidus. So what will be the drug of choice in case of the neurogenic or central diabetes insipidus? It will be your desmopressin. Whereas nephrogenic diabetes insipidus, so the answer is your thiazides. And lithium induced diabetes insipidus, the answer is amiloride. So this you need to keep in mind. So here the right answer will be your desmopressin. So GnRH analog used in hormonal treatment of carcinoma of prostate is, so finasteride is a 5-alpha reductase inhibitor. There is one more drug also, dutasteroid. Nilutide and the cyproterone acetate, they are the androgen receptor antagonist. They can also be used in case of prostate carcinoma, but here the question is regarding the GnRH analog. So this is the GnRH analog. So this can be used in the treatment of prostate carcinoma. So the answer is Answer is goserelin. Goserelin is the right answer. So finasteride, where it is used? Basically they are used in treatment of benign hypertrophic prostate. So which of the following is preferred for infertility treatment of female with increased prolactin levels? So usually you can use both cabergoline and bromocriptine, which will decrease the prolactin levels, but cabergoline is better tolerated and it is long acting as well when compared to bromocriptine. So this can be ruled out. Dopamine will increase the prolactin levels. Again, the carbidopa will increase the prolactin levels. So what you can do is you need to select the either one, cabergoline or bromocriptine. So but among this, the better one and longer acting will be your cabergoline. So you need to pick this answer. So octreotide is given in all of the following condition except. So please remember octreotide. This is a somatostatin analog. Somatostatin analog, and it is preferred over somatostatin. So can we remember what are the uses of somatostatin? It is used for secretory diarrheas. Secretory diarrhea. O stands for esophageal varices. M stands for malignancy, that is islet cell tumor. A stands for your acromegaly, and T stands for your TSH secreting tumors, and there is a overdose of sulfonylureas. So we can use in acromegaly, yes, secretory diarrhea, yes, and also in case of esophageal varices, but not in case of the infective diarrhea. So the drug exception here is infective diarrhea. So moving on to 31st MCQ, that is, which of the following is not used in the treatment of thyroid storm? So you will use the potassium iodide as well. So what happens in case of thyroid storm is we can use propranolol, you can use calcium channel blocker, you can use the potassium iodide. It shrinks the tumor, it makes the tumor less vascular, etc. So here the drug which is not used is the reserpine, which is an antihypertensive drug. Is that clear? Fine. So moving on to 32nd MCQ, that is the L-thyroxine is used in. So L-thyroxine is used in, we cannot use in case of thyroid storm. Yeah. In cretinism you will go with the growth hormone supplementation, whereas Graves' disease you will go with the antithyroid drugs, whereas L-thyroxine is not used in these conditions, but it is used in case of endemic goiter. So the next question, that is the safest treatment of hyperthyroidism in pregnant women is. So they are asking the drug of choice of antithyroid in case of pregnant women. So please remember, it is always propylthiouracil. So propylthiouracil has got high plasma protein binding capacity, thereby it will not be entering, or it will not going to cross the placental barrier. So the drug of choice will be your propylthiouracil. It will not cross the placental barrier. So which is the fastest antithyroid drug among these options? So please remember, the fastest acting antithyroid drug is your potassium iodide. Potassium iodide, it is also called as thyroid constipating agent. Constipating agent. So what are the two advantages you're going to see? So it will going to shrink the gland, as well as it will going to decrease the vascularity of the gland. So this will be useful in case of pre-op workup. So what is Lugol's iodine? What it contains? So basically it contains, the first option is correct, 5% iodine and 10% potassium iodide. So they also belongs to the class of thyroid constipating agent. Again, the main reason, one is to decrease the gland size, you need to shrink it, and to decrease the vascularity of the gland. So next, moving on to 36th MCQ. So the management of thyrotoxic crisis includes all of the following except for. So here you can use propranolol in thyrotoxicosis. You can use hydrocortisone. You can use propyl thiouracil, but not the oral iodine 131 isomer. So if you use these, what will happen is it will going to aggravate the Graves' ophthalmopathy. So this will be exaggerated by oral iodine 131. So they are asked the exception. So the C will be your right answer for this question. So you can use propranolol, hydrocortisone and propyl thiouracil for management of thyrotoxic crisis, but not the oral iodine 131. So next, moving on to the 37th MCQ, that is thyroxine is used in the treatment of which of the following cancer? So again, please remember, thyroxine is used in the treatment of papillary carcinoma. Papillary carcinoma. So next, moving on to the 38th MCQ. So the diabetic patient presented with uncontrolled blood sugar levels. He has history of pancreatitis, family history of urinary bladder carcinoma, is allergic to sulfonylureas, and do not want to take any injectables. Which of the following drug can be added to control blood sugar? So since he has got allergy, you have ruled out the glipizide, which is the sulfonylurea drugs. And liraglutide is a, what is liraglutide? It is a GLP-1 analogs, and you have a GLP-1 analogs, and sitagliptin is a DPP4 inhibitor. So all these drugs are given by subcutaneous. So liraglutide is given through subcutaneous, and sitagliptin has increased risk of pancreatitis. So the best option here is to choose for canagliflozin, which is a sodium glucose SGLT2 inhibitor. Is that clear? Fine. So next, coming to 39th MCQ, that is a 70-year-old female patient has got or diabetes mellitus and hypertension. E presents with renal failure, does not want to take and does not want to take injectables. Which anti-diabetic drug will you prefer in this patient that does not require dose modification in case of renal failure? So metformin, you require dose modification in renal failure, excluded. And exenatide is again a GLP agonist which is given by subcutaneous route, and these two are the DPP4 inhibitor. So please remember, all DPP4 inhibitor requires dose adjustment except for linagliptin. So here the answer will be your linagliptin. So coming to the 40th MCQ, that is insulin causes what? So insulin, so this will be the cell. So insulin will cause potassium entry into the cells. So what will happen to the potassium levels? It becomes hypokalemia. So it can be used in the treatment of hyperkalemia patient. So the insulin causes what? Here the right answer will be your potassium entry into the cells. So sulfonylureas, 41 MCQ, 41st MCQ, that is a sulfonylurea acts by. So as you know that there is two drugs which increases the insulin secretion. One is the sulfonylureas and another is the meglitinide. So here sulfonylurea act by increasing the insulin secretion from the pancreas. Is that okay? Fine. Lactic acidosis is common with. So please remember, the lactic acidosis is more commonly seen with the fenformin, and it was banned, withdrawn. Even though metformin can cause lactic acidosis, the risk is less. Here the risk is more. So here the right answer will be your fenformin. Is that clear? Okay. So coming to the 43rd MCQ, so which is the longest long-acting insulin preparation? So we have which is the longest acting here? So longest acting will be your ultra lente. So insulin, lispro, aspart, glulysin, they are all short acting, or they are also called as rapid acting insulin preparations, whereas glargine, ditimer, degludec, they belong to long acting insulin preparation. So NPH, regular insulin, they fall under intermediate insulins. So coming to the 44th MCQ, that is oral hypoglycemic drugs that is less likely to cause hypoglycemia. So please remember, as we discussed earlier, so the drug which are increasing the insulin secretion will have side effect of hypoglycemia, lot of side effect. So which are those drugs which are increasing the insulin secretion? So those are sulfonylureas and meglitinides. We have rapaglinide, etc. So here glimepiride, gliclazide or sulfonylureas, whereas rapaglinide is the meglitinoids. Rosiglitazone is the drug which needs to be chosen for this question. So oral hypoglycemic drug that is less likely to cause. It is less likely to cause the hypoglycemia. So rosiglitazone is the right answer here. So the long-acting insulin preparations are frequently administered by which route? So usually whenever we talk about the insulin, please remember, if it is used for diabetes mellitus and if it is used for diabetic ketoacidosis. So here usually you're going to have a subcutaneous route, and here in case of diabetic ketoacidosis you're going to give it through intravenous route. And here the special insulin is used, that is the regular insulin. So the option is the long acting will be have subcutaneous route. Next, moving on to the 46th MCQ, that is most important step in the management of diabetic ketoacidosis is. So the patient will be dehydrated actually. So to correct the dehydration, you need to go with the IV fluids first. So you can go with the intravenous fluids here. So if it is not given, you could have selected the insulin. So usually they will give regular insulin. So regular insulin will be the insulin that is preferred in case of diabetic ketoacidosis. Is that clear? Fine. So moving on to the 47th MCQ, that is which of the following regimen of antenatal steroids is preferred for fetal lung maturation? So usually you're going to prefer a dexamethasone because the betamethasone is banned in India. It is not available actually. So dexamethasone 12 hourly, you need to give 6 milligrams 4 doses. So dexa 12 hourly 6 milligram 4 doses. If you were to choose a betamethasone, you need to give a 24 hours 12 mg 2 doses. Is that clear? Okay, fine. So coming to the 48th MCQ, which of the following is an indication for the use of corticosteroids? So this is not the indication. Psychosis, herpes reflex is also not. Subacute thyroiditis, non-steroidal anti-inflammatory drugs are used. Whereas Loeffler syndrome, which is a transient pulmonary infiltrates with eosinophilia. So the corticosteroids are preferred in case of Loeffler syndrome, but not in case of the other conditions. Is that clear? Because of the eosinophilia, these drugs can decrease the pulmonary infiltration with eosinophilia. So coming to the 49th question, that is steroids are indicated in all of the following forms of tuberculosis exception. Steroids are effective in case of tuberculous meningitis, pericarditis, adrenal involvement, but not with respect to the ileocecal tuberculosis. So what is the reason here? Because it can lead to silent perforation of the intestine. So that's why you need to avoid using the steroids in case of the ileocecal tuberculosis. So coming to the 50th MCQ, that is a most potent mineralocorticoid is. So please remember, you need to remember two things. One is the AM and the BG. So the aldosterone is the most potent mineralocorticoid, and the betamethasone is the most potent glucocorticoids. So here the answer will be your aldosterone. So next, moving on to the 51st MCQ, that is all are side effects of steroids, exception is. So please remember, there is a mnemonic to remember this. So glucocorticoids. So it can lead to glaucoma when it is given through topical route. It can cause cataract if it is used through systemic route. It can cause limb muscle atrophy. It can cause ulcers, peptic ulcers. It can cause osteoporosis. It can lead to Cushing's syndrome. It can lead to osteonecrosis, that is avascular necrosis of the bone. Renal failure, it is contraindicated, and in case of TB it is contraindicated, and it will lead to impair in the hearing ability, and they are contraindicated in case of CHF. O stands for, it can lead to edema as well. It can increase the infection rate because of decrease in the immunity. It can lead to development of diabetes mellitus, and it suppresses the HPA axis. So what is the correct answer here? They are asked about the exception. So all are the side effects. It can cause skin atrophy, telangiectasia, edema, folliculitis. Exception is the photosensitivity. So next, coming to the 52nd MCQ, that is systemic steroids can be used in all of the following except. In case of systemic steroids can cause all systemic, please remember systemic they are asking. Systemic steroids can cause all of the following. They can cause hypertension, yes. They can cause osteoporosis, yes. Does it causes cataract? Yes. What about glaucoma? No. So glaucoma is your answer. It is caused only if you are using through the topical route. All other side effects are due to the systemic steroids. So next, coming to the, which is the drug of choice for acute adrenal insufficiency? Again a direct question, that is the drug of choice will be your IV hydrocortisone. IV hydrocortisone will be your drug of choice. So where did we see the dexamethasone? In case of in premature delivery, premature conditions, to increase the fetal lung maturity, you are using 12 hourly 6 milligram 4 hours. 4 doses. Is that clear? Okay. Next, moving on to the 54th MCQ, that is a primary goal of glucocorticoid treatment in rheumatoid arthritis. So as we know, it will going to decrease the inflammation. Yes. Does it going to reverse the degenerative process? No. Development of sense of well-being? No. Prevents the suppression of apathy. This is a side effect. So basically in rheumatoid arthritis, it will going to suppress the inflammation, and there will be improvement in the functional capacity. So this is the right answer. So the most potent topical corticosteroids. So which is the most potent topical corticosteroids? So the answer will be your betamethasone. Betamethasone is the most potent topical corticosteroids. So okay, next moving on to the 56th MCQ. So which is the longest acting glucocorticoids among these drugs? So this is not a longest acting. Prednisolone is also not long acting. Cortisone is not long acting, and it is the dexamethasone which is long acting glucocorticoids. Okay. Next we'll move on to the 57th MCQ, that is bisphosphonates. So bisphosphonates acts by by causing apoptosis. Apoptosis of what? Apoptosis of osteoclast. So basically bisphosphonates will going to prevent the precursor osteoclast into mature osteoclast. So thereby what they are going to cause is they are going to decrease the osteoclast mediated resorption of the bone. So increasing the osteoid formation? No. Sorry, this is the increasing the mineralization of the osteoid? No. Does it decrease the osteoclast mediated bone resorption? Yes. Decrease the parathyroid hormone secretion? No. So the right answer will be your C, that is it decreases the osteoclast mediated resorption of the bone. So coming to the 58th MCQ, that is use of tamoxifen in carcinoma of breast patient does not lead to the following side effect. It can lead to thromboembolic event S, it can lead to endometrial carcinoma S, it can lead to cataract S. Only option here is not seen with is the carcinoma of the breast, opposite breast. So answer is the D. Answer is D. It has got 3B beneficial effect. What are those 3 beneficial effect? One is it causes decrease in the bone resorption, and it is used in case of breast carcinoma, and also in case of blood it will going to increase the HDL levels and decrease the LDL levels. So it decreases bone resorption in case of breast carcinoma, and blood it will improve the lipid profile levels. So next, coming to the 59th MCQ, that is the drug which is used for first trimester abortion. So again the direct answer, please remember, it is not, oxytocin is not used in case of first trimester. Extra amniotic ethacridine lactate is not used. Intra amniotic saline cannot be used. These are can be an option for the abortion, but not a option for first trimester abortion. So first trimester abortion you will be using the oral mifepristone. Oral mifepristone is a drug which is preferred in case of the first trimester abortion. Is that clear? Okay, fine. Next, moving on to the 60th MCQ, that is thromboembolism is due to which of the component in the oral contraceptive pills. So the major culprit of thromboembolism in case of the oral contraceptive pill is that you have a estrogen in the progesterone. It is the estrogen which is going to cause thromboembolism because it will going to increase the clotting factors like 2, 7, 9 and 10, and it decreases the antithrombin 3 levels. So here the answer will be here estrogen. Answer will be here estrogen. But OCP pills, what will have is there will be increased risk of breast and cervical CA, but decreased risk of endometrial, as well as decrease in the ovarian CA. Mainly it can be attributed to the progesterone. So which of the following is a anti-androgenic drug? So please remember, raloxifene is a selective estrogen receptor modulator. Oxymetholone is an anabolic steroid, and stanozol is also a anabolic steroid. This is mainly used for neurotic edema, and this has been used in the treatment of anemia, erythropoiesis, etc. And here the answer will be anti-androgen is your becalutamide, flutamide, etc. So moving on to the 62nd MCQ, which of the following drug should not be given along with the levodopa? So levodopa is the drug which is preferred in case of Parkinsonism. So if you are giving a levodopa, so levodopa with what will happen is they will be degraded with the help of dopa decarboxylase, peripherally available decarboxylase. If you are supplementing with the vitamin B complex, this will going to increase the activity of dopa decarboxylase. Even if you are giving a carbidopa, there won't be any effectiveness. So this will going to increase the amount of synthesis of dopa decarboxylase. That's why you need to avoid it. They are asking which should not be used. You can use carbidopa along with levodopa, MAHO inhibitor yes, benzerazide yes, but not the vitamin B complex, because it will going to increase the activity of peripheral dopa decarboxylase. So coming to the 63rd MCQ, the drug of choice in case of drug-induced Parkinsonism is, it is your benzexol. That is, cholinergic activity will be less in case of drug-induced Parkinsonism. Already the D2 receptors will be blocked. So because of which imbalance, the cholinergic activity will be more. So to prevent the cholinergic activity, we are going to use the anticholinergic, that to centrally acting anticholinergic agent. You have other names like trihexyphenidyl, which is the other name for benzexol, and we have piperidine, we have procyclidine, we have benztropine, orphanadrine, and sometimes you can also use promethazine, etc. Next, moving on to the 64th MCQ, that is a drug of choice in treatment of infantile spasm. Again, a direct answer, it is your ACTH is the drug of choice in case of the infantile spasms. So phenobarbital is used in case of status epilepticus. Carbamazepine is used in case of trigeminal neuralgia as well as in case of simple partial seizures. And phenytoin, again it is used as a anti-epileptic drug. So which is the drug of choice for trigeminal neuralgia here? So as we discussed, carbamazepine being an anti-epileptic drug, it is a drug of choice in case of trigeminal neuralgia. In all other cases, the valproic acid will be the drug of choice in case of generalized tonic-clonic seizure, whether it will be absent seizure, myoclonic seizure, myotonic seizure, etc. So which is the drug of choice to control the eclampsia, control convulsions? So please remember, which is the drug of choice to control the convulsion in case of eclampsia. So here the answer will be your magnesium sulfate is the drug of choice to control the convulsion in eclampsia. One thing you need to monitor when you are giving magnesium sulfate is knee jerk has to be evaluated regularly to find out the toxicity due to magnesium sulfate. Is that clear? Okay. So which of the following has got highest potential to cause metabolic syndrome? So what do you understand by metabolic syndrome? So there will be a weight gain, there will be hyperlipidemia, and there will be new onset of diabetes mellitus. So all these three are the side effects considered as a metabolic syndrome, and this is more commonly seen with the clozapine and olanzapine. All others can also cause, but they are not having that potential as the clozapine and the olanzapine. Is that clear? Fine. So next, moving on to the 68 MCQ, that is a prophylactic plasma concentration range of lithium in milliequivalent dose not included. So please remember, for prophylactic purpose we use around 0.5 to 0.8, whereas for treatment you're going to use 0.8 to 1.2. So here they are asking about prophylactic. Prophylactic you can use 0.5 to 0.8. This is correct. This is also correct. This is also correct, but not 1 gram. 1 milli equivalent, sorry. So the answer is here D, that is 1. So 1 will become a therapeutic dose, treatment dose. So next, coming to the 69th question, that is the drug which is useful in the malignant hyperthermia is dantrolene sodium. Basically it is a ryanodine receptor antagonist. Ryanodine receptor antagonist, thereby it decreases the calcium, thereby it decreases the muscle contraction, thereby it decreases the temperature, hyperthermia. So next, coming to the 70th MCQ, that is drug of choice for the treatment of negative symptoms of schizophrenia. So please remember, clozapine is a drug of choice, you can say, to prevent the negative symptoms as well as the, even in case of the resistant schizophrenia cases. The only thing you should remember, it can lead to agranulocytosis as the side effect. So the answer here is to treat it. It will also treat the positive as well as negative symptoms. So typical and atypical. This is the atypical ones. Typical will have only effect on positive symptoms, but atypical will also have positive and negative symptoms can be treated with the atypical ones. Here the clozapine will be the best drug of choice for the treatment of negative symptoms of schizophrenia. Okay, next, coming to the 71st MCQ, that is 25-year-old male started taking antipsychotic haloperidol since last 3 days. He presented to emergency department with protruded tongue, breathing difficulty along with spasm of the neck and jaw muscles. And what could be the most likely diagnosis? Again, it is a classical feature of the acute dystonia. So acute dystonia is the early side effect that will encounter, and the treatment will be your benzexol. And apart from that, there is a tardive dystonia, which is the late one to occur, very late one to occur, and very late side effect, and the treatment will be your valbenazine. And in between you also have a side effect which is most common, that is with the akathisia. Again, these here the treatment will be your propranolol, and in between it can lead to Parkinsonism, drug-induced Parkinsonism. You will be using again the benzexol, and also it can lead to malignant hyperthermia, malignant hypertension. The drug of choice will be your dantrolene sodium. So this you should remember. So usually all these are the what they are called as extrapyramidal symptoms. So extrapyramidal symptoms are seen with the typical ones, but they are not seen with the atypical ones. So moving on to the 72nd MCQ, that is which drug is the most useful in treating an episode of antipsychotic induced acute dystonia? So usually we give a cholinergic agent to overcome this. So because of the increased cholinergic activity, and here the drug which is having cholinergic activity anticholinergic activity will be your promethazine. So promethazine is the most useful drug used to treat the antipsychotic induced acute dystonia. Next, moving on to the 73rd MCQ, that is in a case of pseudocholinesterase deficiency, the drug to be cautiously used is, again a direct answer, it is succinylcholine, because it can lead to succinylcholine apnea. Moving on to the 74th MCQ, which of the following drugs are believed to be effective in the treatment of postoperative shivering? Again a direct answer, postoperative shivering, the drug will be your opioid group, that is the pethidine. So dissociative anesthesia, very very important. So again a very easy question. Dissociative anesthesia is seen on administration of the ketamine. Ketamine is the example for dissociative anesthesia. So coming to the 76th MCQ, that is the mechanism of action of aspirin is, it inhibits the COX-1 and COX-2 irreversibly. Basically it produces anti-platelet action by inhibiting the thromboxane A2 activity. Is that clear? So usually these anti-platelet will inhibit thromboxane A2 activity in the platelet, and platelet do not have nucleus. It has to wait until a new platelets are formed to generate the thromboxane A2. But what happens to prostacyclin I2? Initially there will be decrease in the synthesis, but since endothelium has got the nucleus, they will prepare a fresh prostacyclin, and this activity will be regained fast compared to the platelet because they do not have a nucleus. So next, coming to the 77th MCQ, that is mechanism of action of the clopidogrel. So clopidogrel is one of the antiplatelet drug which will act on P2Y12 receptor of ADP, So usually it will going to irreversible antagonist of P2Y12 receptor of ADP. Thromboxane A2, this is done by aspirin, and the glycoprotein 2B3A inhibitors are abciximab, tirofiban, eptifibatide, etc. Phosphodiesterase inhibitor example, you have got many things like drugs inhibiting phosphodiesterase enzyme 3,5,1 is the most frequently asked, that is sildenafil, and you have got milrinone, anamrinone, etc. So here the mechanism of action of clopidogrel is they are going to inhibit the ADP mediated cyclic AMP activation. Is that clear? Fine. So next, moving on to the 78th MCQ, that is the anticoagulant of choice in pregnancy. So please remember, anticoagulant of choice in pregnancy will be your heparin. Heparin is the anticoagulant of choice in case of pregnancy. So which of the following plasminogen activator, that is fibrinolytics, can be given as a bolus dose in a patient with the acute myocardial infarction? So they are asking the fibrinolytic which are given through bolus dose. So there are two drugs, fibrinolytics, which are given in the form of bolus. They are called, one is the retiplase and another is the tenecteplase. They are given through bolus and they are safer, and as well as they are long acting ones. So here the correct option is the retiplase. So next, coming to the 80th MCQ, that is which is the soft steroid used in bronchial asthma. So please remember, soft steroid is used in bronchial asthma is your cyclizumab. It is in the form of inhalation. It is taken into the lungs and it is metabolized in the lungs and it will be excreted, and it has got least risk for systemic side effects. So moving on to the 81st MCQ, that is the drug of choice for the treatment of acute asthmatic attack. It is always the beta-2 agonist. So that is like beta-2 agonist like salbutamol. Please don't confuse it not with the corticosteroid. Corticosteroids is required for long term. So for rapid treatment you need to give a beta-2 agonist salbutamol. So moving on to the 82nd MCQ, that is NSAIDs induced ulcer are treated with. NSAIDs induced ulcer are treated with the proton pump inhibitor is the drug of choice. But if they ask about the most specific drug, you can go with the misoprostol. Is that clear? Here the answer will be your proton pump inhibitors. So coming to the 83rd MCQ, that is for chemotherapy induced vomiting, 5-HT3 antagonist having maximal potency. So maximal potency, all are the 5-HT3 antagonists only. The maximum potency will be seen with the palanosetron. It is longest acting as well as the most potent one. Most potent. Ondansetron has got the shortest action, and dolasetron, it prolongs the QT interval. So the longest as well as most potent is the palanosetron. P for P, we can remember. So P for P. One more drug where we remember the most potent statin is, it is your pitavastatin. Again here in case of 5-HT3 antagonist, the maximum potency is seen with the palanosetron. Moving on to the 84th MCQ, that is oral vancomycin can be used for treatment of. So please remember, oral vancomycin is a treatment that can be used in the treatment of pseudomembranous colitis, that is in the case of superinfection cases. Hepatic encephalopathy, you can use lactulose. Here the answer will be your pseudomembranous colitis. Which of the following, if they are not given vancomycin, if they ask about metronidazole also, here you can go with the metronidazole. Is also used in the treatment of pseudomembranous colitis. Okay, 85th MCQ, which of the following drug is a anti-pseudomonal penicillins? So you need to remember CT, MAP. C stands for carbenicillin, ticarcillin. M stands for meslocillin. A stands for azlocillin, and P stands for piperacillin. So here the anti-pseudomonal penicillin, the mnemonic is CT MAP, and the drug here is the piperacillin. Is that clear? Fine. Next, moving on to the 86th MCQ, that is chloramphenicol acts through, again is a direct answer. It acts through 50S ribosomal unit. So act at, so the mnemonic you can remember is buy at 30, sell at 50. So this is aminoglycosides and tetracyclines will act through 30S ribosomal unit, and we have a cell, that is streptogramins, we have erythromycin, we have linezolid, lacosamide. All these drugs will act at 50. Addition to this, you can add on macrolides, and chloramphenicol will also act on 50S ribosomal unit. So moving on to the 87th MCQ, that is linezolid is the best used for. So please remember, for the treatment of MRSA we use vancomycin is a drug of choice. If it is a VRSA, vancomycin resistance, you can go with the linezolid. Here the answer is VRSA. So highest photosensitivity is seen with which of the following drugs? Which of the following, you can say which of the following fluoroquinolones. So please remember, it is your lomifloxacin and the sparfloxacin. So sorry for the spelling mistake here. Sparfloxacin. So if we have lomifloxacin and sparfloxacin, it has got highest photosensitivity reaction. Here the answer is option D. So moving on to the 89th MCQ, that is a gray baby syndrome is caused by. So again a classical MCQ. This is caused by chloramphenicol, gray baby syndrome. So Redman syndrome is seen with which drug? It is seen with the vancomycin. Is mainly due to the histamine mediated reaction. Histamine mediated reaction. Is that clear? Fine. So coming to the 90th MCQ, anti-tubercular drug that can cause hyperuricemia. So please remember, hyperuricemia is classically seen with the pyrazinamide. So when you talk about HRZES, so this is the sidal drug, this is the sidal, this is sidal, ethambutol is static, and again streptomycin is sidal. So what about the hepatotoxicity? So it has got hepatotoxicity. Rifampicin can cause hepatotoxicity, pyrazinamide can cause hepatotoxicity, but not ethambutol and the streptomycin. What about their activity? So I can remember it as bribe. So if you cover this R, again it will become, it has activity both on intracellular as well as extracellular, Pyrazinamide has got only active as intracellular tubercular organisms, and ethambutol has got intracellular as well as extracellular, and streptomycin has got only activity on the extracellular organisms. Is that clear? Fine. So usually INH, what will happen is, in case of the in case of slow oscillator, it can lead to peripheral neuritis. In fast oscillators, it can lead to hepatotoxicity. So this peripheral neuritis can be overcome by giving the pyridoxine, supplementation. So rifampicin can cause orange reddish urine, which is not a harmful, and it can lead to flu-like syndrome, etc. etc. Is that clear? Fine. So coming to the 91st MCQ, that is fastest acting drug on lepra bacilli. So please remember, fastest acting is the dapsone. So what are the two regimens you should remember? One is the multibacillary and the paucibacillary leprosy. In multibacillary it is 12 months and here it is 6 months. So the regimen remains same, only the duration will differ. So you can remember it as RCD, rifampicin 600 milligram daily, and you have clofazimine 50 milligram daily, and the 100 milligram under supervision, it is 300 milligram supervision monthly, and you have a dapsone which is 100 milligram, it is the daily. So rifampicin 600 milligram daily, clofazimine 50 milligram daily, and in addition to that you need to have a 30 milligram of clofazimine under supervision monthly, dapsone 100 milligram daily. So this is all good for both the multibacillary leprosy as well as paucibacillary leprosy, only the duration will differ. So next, moving on to the 92nd MCQ, the drug of choice in case of herpes simplex encephalitis is. So please remember, in case of herpes simplex, the drug of choice will be your acyclovir. This is the antiviral drug. So next, moving on to the 93rd MCQ, that is the viral HIV integrase inhibitor. So the name itself suggests an integrase. So you can see for gray. So raltegravir is the viral HIV integrase inhibitor. Is that clear? Enfuviride is the fusion inhibitor. Again, maroviro is the fusion inhibitor, and we have a raltegravir, which is a integrase inhibitor. So 94th MCQ, which is the drug of choice in the patient with severe complicated falciform. So in case of chloroquine sensitive, we can use chloroquine. In case of chloroquine resistant, you need to go with the other group of drugs. But in case of severe complicated malaria, you need to go for IV preparation, that is the artemisinin combination, and in case of artemisinin, you need to go for artesunate, IV artesunate. Here is the drug of choice in case of severe complicated falciform malaria infection. So which is the drug which is used for removing the hypnozoid forms? It is your primaquine. Please remember, primaquine is used for removing the hypnozoid forms or the dormant forms, etc. So 95th MCQ, which is the drug of choice for Kala Azar? Please remember again the classical easy question. Amphotericin B is the drug of choice for Kala Azar, sleeping sickness. So which next question, that is 96th, anti-malignancy drug which is potentially cardiotoxic. It is your donorubicin, doxorubicin. They are the cardiotoxic in nature. Bleomycin will cause lung fibrosis. Is that clear? So which has got cardiotoxicity is your doxorubicin, donorubicin, etc. So coming on to the 97th MCQ, that is the Mesna. Where do we use Mesna? Mesna is used for treatment of cyclophosphamide induced hemorrhagic cystitis. So Mesna is an antidote for hemorrhagic. You can prevent the hemorrhagic cystitis. So coming to the 98th MCQ, that is the drug that is having radioprotective nature. Again a classical MCQ. The amifostone has got the radioprotective nature. That's why they are used to decrease the side effects of cisplatin, as well as they decrease the xerostomia in case of irradiation therapy. So they are used in to decrease the cisplatin induced nephrotoxicity actually. So they decrease the cisplatin induced nephrotoxicity, as well as they decrease the xerostomia in patients who are undergoing irradiation. Coming to the 99th MCQ, that is medical adrenalectomy is done by. So please remember, medical adrenalectomy is done in case of only in case of inoperable cases of adrenocortical cancers. Here it is the mitotan is used for inoperable cases of adrenocortical cancer. So this is the example for medical adrenalectomy. So next, coming to the last and centurieth MCQ, that is bevacizumab. Bevacizumab is a vascular endothelial growth factor which has been tried and which has been shown effective in the treatment of diabetic retinopathy. Apart from that, they are also used in the treatment of colorectal cancer. They are used in the renal cancer. They are used in brain tumors. They are used in case of ovarian carcinoma and also in case of non-small cell lung carcinoma. So this was about the expected 100 MCQ from the part 2 discussion. So till now we have covered all the important topics with optimum MCQs from each of the topics, and this would help you in terms of answering many MCQs, as well as it will clear your doubts. So please remember the discussion part, and also if you have any doubts you can put it in the comment box or in the group, and we will try to answer those questions as early as possible. Hope this will be helping in preparing for your upcoming NEET exams. Thank you.